Hi, this is QD Clinic, brought to you by Room Now Live. I'm Jack Cush from Room Now. Today's case, kid arthritis. 14-year-old comes in with her mom. Mom has rheumatoid arthritis. Worried about her child who's had joint pains going on for the last year. Exam, as you can imagine, largely unrevealing. A number of joints are tender, PIPs and shoulders and hips and knees, but really not much to show despite 2 hours of morning stiffness, polyarthralgia, no systemic features, a history of a prior ligamentous tear, not necessarily provoked by trauma. So I learned this lesson like 30 years ago when seeing kids, and I don't know what the diagnosis because I'm not really finding much, and I'm considering a diagnosis of myofascial pain syndrome or fibromyalgia in a child, although they often don't have tender points. I've been surprised by the diagnosis of hypermobility syndrome. It's really quite common, especially in young adolescent females. It's easy to diagnose, you just have to look for it. And the way you look for it is typical signs of hypermobility, being able to bend your finger back and touch your forearm, being able to bend your thumb inwards and touch the volar first surface of your forearm. I can't get there. I am not hypermobile. Hyperextension of the elbow. So it's actually the Baton Score, the Baton criteria, of which there's 5 elements. One is hyperextension of the 5th metacarpal greater than 90 degrees, passive apposition of the thumb to the flexor aspect of the forearm, hyperextension of the elbows greater than 10 degrees, hyperextension of the knees greater than 10 degrees, and flexing the trunk and placing the hands flat on the floor. Those are all 5 of Baton Score, and then you have to have 4 or more Baton Score to meet Brighton's criteria, as long as you have arthralgias and marfanoid habitus and other musculoskeletal findings and extraarticular findings. That's what this patient had. Again, you should know that such patients, again, more likely female, more likely adolescents. They can have other things, including ligamentous injuries, which this person had, either a marfanoid habitus, flat feet. They may have lens problems. The differential diagnosis is Ehlers-Danlos, Marfan syndrome, osteogenesis imperfecta, homocystinuria, rheumatic fever, or acromegaly. I'm reading from my textbook, rumenology.com or rktext.com. And I think it's, again, I refer to it all the time. I heard something really smart from a colleague of mine the other day talking about teaching medical students or residents. He held up his cell phone and said, you know what? This is my puck. Imagine it's a cell phone. They should make cell phones in the shape of a puck. Wouldn't that be cool? Especially for people who like hockey. Anyway, he holds up his cell phone to his residents and students, says, I'm not going to ask you anything that isn't already in this thing. So don't memorize anything, just know how to use this thing, the phone, to find key information. It's true, rote memorization is a thing of the past. It helps to memorize stuff, but there's an information glut. Use the phone. You can use the phone to look up stuff on my textbook, rumenology.com. Anyway, interesting case in an adolescent. I do see adolescents and kids because that was my interest in rheumatology and getting in, was children with arthritis and Still's disease, etc. So that's it for this week. Actually, we'll have one more episode of QD Clinic tomorrow, and check out Room Now Live. The weather for next week, 8 days away in Fort Worth. It's going to be 75 and sunny or partly cloudy. Let's pray for sun, but it's going to be a good meeting in a great city. Hope you're there.